Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Welcome to the MS Gym, everybody. My name is Trevor Wicken, and I am here to show you how to best exercise in order to manage your MS symptoms. And every exercise that we do in the MS Gym is specifically designed to help you work around the lesions in your brain, the demyelination in your body, the slow muscles, the shaky legs, the uncoordinated frame that you have, and really start to create an MS movement practice, whether you're standing or in a chair or a little bit of both, in order to help you slow down the progression of MS. So a lot of these exercises that we go over in the MS Gym are really meant to help complement all the other great things that you're doing for yourself, whether it is a drug-mediated therapy with like Rituxan or Lemtrada or biotin or something like that, whether it is a nutritional intervention like the SWANK or the WALS protocol, whether you've taken a huge step in getting something like a stem cell transplant, or whether you're newly diagnosed or you've had MS for 20, 30 years and you're just trying to manage and you're doing okay, but you need to get stronger and you need to get more balance. Like, this is the place for you. So what I want to chat with you guys about today is how to work out in a chair, whether you're totally chair bound or whether you just sit in a chair a lot because you're too weak to stand and you're too weak to ambulate or move around your house or out and about. I've worked with both. I've worked with both sets of people, both sets of clients over my career, and I can tell you that you can get stronger. The thing is with MS that I always tell people is that, you're not paralyzed. And although, unless you're clinically diagnosed paralyzed, but even then, I've had people that are paralytics in a chair that have had strokes and everything else, literally get up and walk again after working with me for, 6 months to a year. So here's the thing. In order to get more mobile and stronger in your chair, everybody thinks they're limited to just being able to use their arms, because they're like, well, this is all I got. Basically, from the shoulder down is all I got. And that's just not true. Especially with MS, again, your spinal cord, even though it has some scarring and it has lesions on it, it is not severed. There are still a lot of neural tissue, or a lot of nerves, a lot of neural tissue still left over for you to utilize and you to activate. And the goal is to really get your brain to tune into those other spinal cord nerve cells and start using the ones that you have left. Because what happens with MS, it's a big neurological trauma to the brain. I mean, it's like your body goes into shock. It's slow, but eventually your body just gets locked into this dysfunctional movement pattern because of the demyelination and the scarring, the lesions, whatever, in your spinal cord, and it kind of gets stuck there. And you have to teach it how to get around what it knows. Because in order for you to, let's say, stand up out of your chair, it takes muscles A and B in order for that to happen. Those have to actually kick in and work. Well, there's also nerves and muscles C, D, and E. And if MS comes in and it takes out A, like nerve root A, and it takes out half of nerve root B, okay, when I say root, I mean route, like the route that it's taking from the brain to the muscles to get you to stand up. So it takes out route A or road A, and then it takes out half of road B. You still have C, D, and E left. They're just not, they just haven't been used for standing up out of a chair as much throughout your life prior to MS or during MS, but they're still able to perform the motion. They still feed and still connect with the muscles that you need to stand up. So our job and our objective when we work out or we exercise in a chair is to get those those roads, half of B and C, D, and E to start kicking into the muscles that road A used to exclusively connect with. So what that means is that, if your glutes, you need your glutes or your butt muscles to stand up out of a chair. You also need your abs. You also need your spinal erectors. If those are all affected by your MS, by that road A, and they connect in. So road A connects in with those three muscle groups, your glutes, your abs, and your spinal erectors, the ones that help you stand upright. There's also road B, C, D, and E that actually connect in there too. It's just that we haven't used those as much in our life. So now it's time to tell those muscles, hey man, you can kick in too. We're just going to show you how. So you're asking, okay, cool man, so how do you do that? Well, what we need to do is we need to use our chair for our support. Our chair as our balance. Our chair as our workout station. And in order to first start out getting stronger in a chair, you need to activate your core, because the core is everything. The deep abdominals, the spinal erectors, the pelvic floor, the diaphragm, the rotating abdominals, which are called your obliques, your thoracic extensors, which are the mid-back muscles, your cervical extensors, which are your neck spinal stabilizers, and we need to get you mobility fed back into your body. So the first thing that we need to do is we need to get in, and a lot of times it happens, especially if you've been in a chair for a while, or you have MS, is the elusive MS hug. And what that means is, what that is it's a spasm in the diaphragm. You actually have spasticity in your diaphragm. So not only do most MSers have some form of that in their diaphragm, in fact, most non-MSers have some form of spasticity in their diaphragm, and that is why people's posture is so bad. And we are such a global sitting culture that those muscles really get tight and overbound, and they just get put into spasm. Those muscle fibers get shortened, and when the diaphragm gets put into spasm, pardon me for just a sec. I just choked on something. I choked on some tea I was drinking. So when those muscles in the diaphragm get put into spasm, it's not good. What it does from a structural standpoint is pull your trunk forward, so it makes you slump down in your chair. And then also from a physiologic standpoint, it really inhibits and impedes your body's ability to take in oxygen because you can't expand your lungs very well. So the first exercise that you need to do is you need to sit in your chair. And I want you to try to scoot to the very edge of your chair as much as you can, or scoot all the way back to the back of your chair and put some kind of like board or something very rigid behind your back so you can sit up tall and you can lean against it. The problem with most wheelchairs is that the backs on them are very loose and they promote you slumping in your chair. So I want you to sit up as tall as you possibly can. Now, what I want you to do is find your ribs. So you find those ribs that are kind of like the bottom of the rib cage that start at the bottom of your sternum or your chest bone, breastbone, and work your way down. And you can feel those rib bones, the bottom of the rib cage. Now, what you want to do is get your fingers and you're going to put them kind of on right under the rib cage. Okay, right under the rib cage, and you're going to kind of push in, curl your fingers, and then kind of pull out on that tissue. You push in, curl those fingers, and pull out on that tissue, right on the bottom of the rib cage. Okay, it's going to be sensitive, and what you're going to do is work your way down your rib cage and feel where those sensitive muscles are, and you're going to find it. Trust me. Like everybody that I do this on, everyone's just like, "Oh my gosh! Like, why is that sore?" That's the first thing. Why does that hurt so bad? Well, it's because those muscles are in a state of spasm. They're locked down, and when they get locked down, then they get very bound up, and all those nerves kind of are smushed together, and the tissue's smushed together, and the muscle tissue of the diaphragm actually adheres to the fascia, and the fascia adheres to your skin, and it creates this big old balled up mat of not awesomeness. That's a technical term, not awesomeness. Okay, so you want to get in there for about 30 to 45 seconds and work your way down that diaphragm as much as you can and find those spots. And you do that for about 30 to 45 seconds, okay? Now, once you have that done, you're going to work on what's called 360-degree breathing. So 360-degree breathing means that what it says, you literally breathe out 360 degrees. Like your diaphragm and your chest cavity is meant to expand out in all directions. It's supposed to like fill up like a big canister full of air. And if you look and see how a lot of people breathe, especially MSers and especially those in chairs, they breathe from their chest or they breathe from their belly in a state of distension. It looks like their belly just kind of sticks out all the time because their abdominals are so weak, number one, and typically they also chest breathe, which means they're breathing from the muscles underneath the ribs, the muscles in the neck, the muscles in the shoulders, the muscles in the chest, because like the abdominal cavity, the chest cavity muscles that are responsible to help you breathe are so constricted and so smushed down by you sitting all the time. So what you want to do is after you do that diaphragm release, you want to scoot to the edge of your chair as much as you can. And I want you to sit as tall as you can. Okay, again, if you can't, get some kind of stiff board or book or something that's tall enough that you can put behind your back in the chair, because I want a very rigid surface that you can kind of sit up tall and lean against. I don't want you to slump. The last thing that you want to do in a wheelchair is slump. So what you want to do is you want to take your hands, and just like you're going to put your hands on your hips, you're going to put your hands right at the base of your ribs, okay, or right on those ribs, right at the bottom of that rib cage. Now, what I want you to do is take a breath, and when you take a breath, I want you to think about breathing into your hands. So I want you to push gently against your rib cage, and I want you to breathe into those hands, and you're going to feel those hands kind of expand out. Now, this is going to be a really weird motion for a lot of you. It's going to feel very foreign. You're like, what the heck are you talking about, dude? But trust me, if you can just close your eyes, push in gently, super gently, just give a little bit of resistance into your ribs. And then as you breathe, I want you to think about breathing into those hands. You're going to feel kind of your body kind of shudder and shimmy and shake. That shake are those, there you go, those muscles that are trying to kick back in and work. Okay, those are called your respiratory muscles. You need those in order to work your deep core well, in order to get oxygen into your body and into your cells. Because if you're oxygen depleted because you can't breathe well, that's going to contribute to your fatigue. It's also going to contribute to your brain fog, your depression, that just feeling of just malaise and just not feeling good. So you really want to work on breathing out into those hands. Okay? Now, real quick, I didn't mention it at the beginning of the recording, but the website, I actually have an entire PDF that you guys can use for this. And the website for this is called exercisewithms.com. So exercisewithms.com. And when you get in there, you'll see a list of different free programs that I offer you guys in the MS Gym. One of them is called Chair Core Strength. So if you click on that and you register that, you just need to put in your name and your email to get it so I can deliver it to you. You get this PDF that I'm talking about. And all these exercises I'm talking to you about, I'm walking you through them. Okay? So you're going to have pictures. It shows you the direction you want to push. It walks you through with words and tells you exactly how to do these exercises. Okay? So I'll mention that again at the end of the show. But exercise with MS, and you want to go to the Chair Core Strength program. Okay? All right. So now that we got that diaphragm released and we got our 360 breathing happening, we're going to go into deep abdominal strengthening. So sit up as tall as you can in your chair. So either with your back on that board or on the edge of your chair. And what you're going to do is you're going to put your hand right over your belly button. Okay? Now, when you do that, what I want you to do is sit up as tall as you can. And I'm talking like as you can is the key word. Sit up as tall as you can. You just try to push up as much as you can. Once you do that, you're going to start working what's called your spinal erectors. That's going to help you sit upright. The taller you can sit, the more open your diaphragm is going to be in your abdomen, which means you're going to be able to breathe better, and you're also going to get new core strength going on. So I want you to sit up nice and tall. Try to think about pushing up through the top of your head. And then I want you to put your hand on your belly button. Now what I want you to do is just take a slow inhale, and you're going to feel that belly kind of push in your hand. And then I want you to exhale, and on the exhale, I want you to pull that belly button away from your hand. So it's an inhale, and then an exhale, and I want you to say ha. And you can hear my air coming out of my lungs. As you do that, I want you to pull your belly button away from that hand. Now go ahead and inhale again, and then exhale. Inhale. Exhale. And pull that belly button in. So this works on your 360 breathing, and it also works on your deep abdominal strengthening, okay? So you want to do about 10 to 12 of those multiple times a day, okay? Just while you're sitting in your chair doing your thing, multiple times a day, you want to work on strengthening those deep abdominal muscles, okay? Now, the next thing I want you to do is we're going to talk about pelvic tilting. So when you sit in a chair and as you get tighter and tighter and tighter, we talked about your diaphragm getting tight, right? So your diaphragm's getting spastic, and then because you're sitting so much, the muscles that are called your hip flexors, or the muscles on the very top of your thigh that are connected up on your hips, are going to get very, very tight from you sitting. And so what you're going to do is that you're going to sit in your chair, sit up tall again, try to hold in those abdomens or abdominal muscles that you just worked on. And then I want you to think about tucking your tail, okay? So tucking your tail. So when you do this, a lot of people do this and they round their upper back. I want you just to try to use your mobilizers, your spinal mobility muscles, okay? Just to use your spinal mobility muscles. Or pelvic mobility. I'm sorry. Pelvic mobility muscles. My fault. As soon as that came out of my mouth, I'm like, that didn't sound right. Your pelvic mobility muscles. So I want you to put your hands on your hips, sit up tall, and then I want you to think about just tipping your pelvis back using your what are called your obliques. Now you're not going to know where those are without me showing you, but you can see it on the diagram that you'll find in exercisewithms.com. So once you get that and download that, you'll see exactly what I'm talking about. And then you can actually go back, listen to this radio show, and walk through these exercises. So once you find those muscles, so what I want you to do is tip that pelvis back and just hold. So I want you to think about tipping that tail back, and it's not going to move. It's not a big movement. It's very small, but it just gets those muscles activated, and it shifts you out of sitting directly on your tailbone and helps you sit more on the back side of your sacrum. By you doing this, it's going to help you sit better in your chair. It's also going to position you better for when you do go try and stand up. Okay? So release that. Now let's go ahead and do that again. So abs in and tip that pelvis back. 1, 2, 3. Let it tip forward. Tip that pelvis back. 1, 2, 3. Let it come forward. Tip that pelvis back. 1, 2, 3. Come forward. Tip that pelvis back. 1, 2, 3, and come forward. So you did about 4 or 5 of those, and I would recommend probably doing about 10 to 15 of those. I would probably do 10 in a set, and again, do those multiple times a day. So with your, you can work on your breathing, you can work on those deep abdominals, that belly button pull away, you can work on these pelvic tilts, and then you can also work on this next exercise. Okay, it's called sitting tall. So what I want you to do is sit on the edge of your chair. Now, I'm going to let you slump, okay? This is when I let you slump. So you're going to sit on the edge of your chair, okay? And I want you to find your abs, so find your abdominals. And then I want you to tip that pelvis back. And I want you just to let your upper body kind of slump. Don't let the abdominals go. Just kind of slump in your shoulders, all right? Now, with your abs drawn in, so pull that belly button towards your spine, I want you to try and push up through the top of your head and sit up as tall as you possibly can. So I want you to think about holding an apple underneath your chin so you're not lifting your chin up to do this. Hold an apple under your chin and push up through the top of your head, right through the crown of your head. Try to get as long as you can throughout your spine. So lengthen each vertebrae as much as you can. And for some of you, this is going to be very difficult. So you can kind of use your forearms on your chair. You can use your hands on your chair. Just make sure your shoulder blades are pulled back. And I want you to sit up and push on that chair as much as you can for about 5 to 10 seconds. Okay, and then just go ahead and relax. Okay, when you relax, keep those abs in. Don't just collapse. I know a lot of you just went, oh, right? So tip that pelvis back, pull those abs in, and then go ahead and push up through that top of your head as much as you can. Push, push, push. Abs are in. Okay, lightly come back down. Let those shoulders shrug. Take an inhale. And on the exhale, and ready, breathe out. Exhale, come up. Sit up tall, apple under your chin. Push up through the top of your head. Shoulder blades are being pulled down towards your back pocket. Back pockets. If you just think about pulling your shoulder blades down toward your back pockets, it'll help you a lot. Okay? Slowly relax. And then come back up. Push up through the top of your head. Push up. Push up. Pull those abs in. Tip that pelvis back. Push up. Push up. Push up. Come back down. Relax. Let's go one more of those. Abs are in. Big breath in. Breathe out. Pull those abs in. Push up through the top of your head. Hold that apple underneath your chin. Push up. Push up. Push up. You got 5, 4, 3, 2, and 1. Good job. Okay, go ahead and relax. Nice work. Nice work. Okay. So, all right, we got one more exercise to do. And this is going to just kind of require you to sit up in your chair tall again. So it's going to kind of put this all together because we got to get all the way up the chain. Okay, so we worked on the diaphragm. We worked on the abdominals. We worked on the pelvic tilting. We just worked on what's called spinal extension. And now we're going to work on the upper body mobility. So once you get this upper body mobility going, it's going to help you a lot. So what I want you to do is sit up nice and tall in your chair, just like you were on that tall posture, not pushing as much, but just sit up tall. And then I want you to put your hands at the side of your armrests, okay? So you're kind of like just hanging over the top, like your body should look like an A. So your palms are open, your arms are on the side of the armrest, or if you can take your armrest off, cool. If your armrests are really wide, put your hands up in kind of a like don't shoot position where your hands are up. And all I want you to do is I just want you to rotate your body to the right. So just rotate your body to your right, hold that, and then now come back to center. Rotate your body to the left, and then come back to center, okay? Keep your abs in and your pelvis tip back. Push up through the top of your head gently. Toe head and rotate to the right. Hold that, and come back. Rotate to the left. Hold that, and come back. Rotate to the right. Hold that, and come back. Rotate to the left, and come back, okay? So that should feel pretty good for you. It might be very difficult for you because those muscles have not worked in forever, right? But it should feel pretty good. All right. So once we got all that going, like that is a complete spinal mobility program that we just did for you. We activated, we released spastic muscles, we activated underactive muscles, and then we put it together in kind of what's called an integrated format or multiple muscles working at the same time. So this is how we train in the MS gym. If you're in a chair, fine. Like let's start in a chair and get you really good in a chair before you even attempt to stand back up. All right. Because here's the thing, you guys, if you can stand up out of a chair, like whether it's just for 5 seconds or whether you can stand and you can, you can walk a couple steps or you use a walker or a rollator or something like that, that's fine. If you can sit up and you can stand, we can get you to walk. And if the thing is, if you are completely wheelchair bound, you need to get these muscles kicked in. Because I'm telling you what, like I've seen crazy stuff happen. And when these muscles start to kick in, the body starts to realize that it still knows how to stand up. The muscle memory is still there. You stood up like a gazillion times before you got MS your entire life, right? Because most of MS doesn't really happen. Majority is between like 35 to 45 to 55 years old, right? So you've had at least 30 years to stand up out of a chair. So you've done it a lot. And so that pattern is still in your brain. And so by working on these exercises and getting your core stronger, right? Releasing that diaphragm to get more oxygen to your body, working on breathing better and getting your abdominals to fire, getting your like deep abdominals to know what it means to stabilize your spine. Learning how to tilt that pelvis back is a super key exercise for standing up and also for walking with foot drop and spasticity and all that. Being able to sit up tall in your chair and work those spinal extensors, and then also to be able to rotate and have upper body mobility is key for you to be functional in your chair. All right? So these muscles are super duper important, and I would encourage you to work these exercises as much as possible. So in order for you to get a complete exercise guide that is the chair core strengthening program, and there's some extra added, exercises that we did not cover in this radio show, but you'll see that you can do them on that guide. You're going to go to exercise